go ahead and start. We know of a few more people who we think are on their way, but they will hopefully filter in shortly. I'm Carol Runyon, and I'm in the School of Public Health and director of the PIPER program, which stands for Pediatric Injury Prevention Education Research Program. That's a joint project of the Schools of Public Health, School of Medicine, and the Children's Hospital. And we are hosting a seminar series that Sarah put some information up here on the board. These three are all part of our seminar series, so please make note of them for the spring semester. But I also wanted to draw your attention to the seminar by Professor C. Terrett from Johns Hopkins University. He's one of the Dean's Distinguished Lecturers who will be here December 17th, so just in a couple of weeks. He's a public health attorney and will be talking about litigation as a tool for public health, including topics like smoking and salt in foods, as well as firearms, which are some of his major issues. So, and the other speakers, David Olds, many of you know, is a psychologist who runs the Family Nurse Partnership Program. Ingrid Zinswager is an internist who does work on prescription drug overdose. And Jerry Jerkovich is a surgeon who's particularly interested in the acute care trauma system. So hopefully those topics will appeal to you and that you'll be back. We do have an evaluation that we'll pass around for the end, and we'd appreciate it too if you would, and Sarah, maybe you can send around just a sign-up sheet so we know who's here and can be sure that you get information about future seminars as well when we have the rooms and everything sorted out for these. I'm really pleased that today we have Dr. Gary Melton as our presenter. Dr. Melton is a psychologist, community psychologist, persuasion, among others, who came to the University of Colorado last spring after being at Clemson University for a number of years. He's a professor in the Department of Pediatrics and also associate director for community engagement at the Kemp Center. Did I get that right? He's editor of the Journal of Orthopsychiatry and also co-editor of the International Journal of Child Abuse and Neglect. He's on multiple advisory boards, has a long CV with 300 or so publications, lots of awards. I won't go into all of that, only to say he's very prominent in the field of child maltreatment, child rights, and community-based interventions, which is the topic of his talk today, and he may want to fill in other biographical information. So, Gary, thank you.
Well, the sort of background in this project that I'm going to be talking about are really it's beginnings of a small movement. Goes back more than 20 years to the time when Dick Krugman was chair of the U.S. Advisory Board on Child Abuse and Neglect, and shortly afterwards I was vice chair. The initiative became a test, in effect, of the recommendations of the board, which no longer exist. But with that background, and there are people in the room that were heavily involved with this, or that will be in the room, we think. Robin Kimbrough Melton led the community outreach part, and Asher Ben Aryeh, who I think will be here shortly with his colleagues from Israel, was one of the research leaders. And actually, I think Des Runyon was involved in some of the measurement development of this, if I remember correctly, along with a cast of hundreds, or wasn't that many actually, but a room full. What the impetus was, with much media fanfare, the board declared an emergency in the child protection system based on the scope of the problem, the consequences, and the moral disaster that's involved in not responding to them. And what got missed a bit at the time from the other child welfare groups was that the notion the board had was that this was not a question of underfunding, but instead it was a question of system misdesign. And in particular, that the child protection emergency was a result not of a lack of motivation, not a lack of investment of resources, but instead a mistaken view of what the problem was. And that when the current system developed from Henry Kemp's efforts in the early 1960s, simply the notion was that child maltreatment was much less frequent than we now know it to be. Kemp's best guess, based on surveys of emergency rooms and of police departments, if I remember, prosecutors, was a few hundred cases in the United States each year. And the same sort of notion was that they were egregious cases, but they were relatively easy, in the sense that it was easy to tell that there were egregious things going on and that something had to be done to intervene with them. And so, based on those erroneous assumptions, the system that we have today is essentially a case-finding system. Now, we all know the numbers that come into the formal system aren't the same as what happens in reality, but we also know very well that the existing system is overwhelmed by the numbers that do come in, which are in the order of 3 million a year in the United States. And so the board concluded that the real problem here was a system that was punitive and investigatory, that it was based on triggering on accusations, not on needs for help. And then the colorful language here that got cited a lot in the media was, it's become far easier to pick up the telephone to report one's neighbor for child abuse than it is for that neighbor to pick up the phone to request and receive help. And that many thousands of American children and families are waiting for our government and society as a whole to respond to the plight with more than just a report and more than just an investigation. That in essence, the system as it currently exists pushes people to think that their responsibility is over when they make a report, and that gets in the way of a safer society for kids. So, that not only gets in the way in terms of community responsibility, that it misdirects us in terms of what the solutions are. It may even make things worse by weakening primary community institutions and increasing distrust among parents. Within that, the board essentially argued for a neighborhood-based system, which is what you're going to be hearing about in a moment, as we operationalized it in the upstate of South Carolina. At that time, we were basing our recommendations in large part on a logical analysis that for child protection to work, it needs to be present in everyday life. But also that empirically, neighborhood quality, particularly in regard to economic resources and neighborhood stability, were already known to be heavy predictors of child maltreatment rates. Since then, the evidence has mounted, in my view, a much stronger case that not only are the economic and social factors important, but that even when you control for those factors, then neighborhood quality per se is an important determinant of child maltreatment. I think the most convincing study is one that was done by my former colleague Jim McDonnell and a brand new PhD as of a couple days ago, Tracy Waters, in which they did drive-throughs in the neighborhoods that we were working with in South Carolina. As I recall, there's about 150-ish or so of them. And simply recorded what you can see when you drive through. So whether there are fences, whether there's a sign that says what the neighborhood is, whether there's trash around, whether there's people on the streets, what they're doing, never talks to a person. And with that, after controlling for the average income, housing value, residential stability, ethnic mix, et cetera, in the neighborhood, the things you can get on census data that relate to social characteristics, still about 25% of the variance in parents' self-reports of the safety of children in their own homes, not in the neighborhood, in their own homes. And almost that much in terms of hospital data using ICD-9 codes that the proverbial expert panels had suggested were perhaps indicators of maltreatment. That amount is variance in the ultimate rates by neighborhood. So take away all of that, just simply look at what you can see physically and the basic social characteristics of a neighborhood, and it's roughly a fourth of the variation in child maltreatment rates. That's extraordinarily higher than anything in psychology in terms of child maltreatment. And my sort of sidebar here on this, which I'll implicitly elaborate along the way, is, in my judgment, the biggest lesson of modern social science is situations count. Individuals don't much. And the much is, it's only in situations where there's not neighborhood stress and not family stress that indicators of strengths become important. So it's a small proportion of the variance, and it's only after other things are out of the way. The only psychological marker that's been reasonably highly related, but still nowhere close to this, is depression, which in my judgment relates directly to how caring and the neighborhood is and what sort of resources that it has. It turns out that the physical markers of social isolation, the keep out signs, dogs being around, etc., are the very strongest single indicators. The service area I'll get into in a moment, but this is a really heterogeneous area of upstate South Carolina. It may not look like America, but it looks like the South. And that it's, I think, somewhere in the 20% African American, maybe 5% or so Hispanic, and mixed social class in mixed rural, urban, suburban, mill towns, etc. So it's not an area that is particularly in trouble. It's average overall. And within that, about a fifth of the family, surveying randomly households of young children. So the methodology here is first doing a random sample of homes, then going and knocking on doors after some prompts of letters that somebody will be doing that, and then pulling out from those the families with young children, and then doing about an hour interview with them. We get down to the parents with children, we get about 90% compliance, which is extraordinary to me, given how intrusive the interview is. But what's clear here is just basics. About a fifth of the families really don't have anybody they can depend on. They don't know anybody in the neighborhood. They don't know where they would get help if they have a child care emergency. They don't know the children are the peers of their own children. And about a fourth of the isolated parents had college degrees, but as you might expect, which is itself pretty significant, that the isolated parents tended to have lots of things going on in their lives that were difficult and to have few resources. So it's an endemic problem. It's a more endemic problem when there's both economic and social poverty. And parents then accurately perceive their children to be unsafe in the neighborhood. So the catch on this was that the advisory board's challenge to the country was that we need to strive to overcome isolation. We must tear down the walls that divide us by race, class, and age. We must create caring communities. We must take the time to see the need and lend a hand. So the strategy that the board concocted is one basically on building connections among people and using endemic or the existing assets in the community to do that, both economic and social. And that then led, at the same time, the board was not particularly sanguine about its assumptions or its recommendations, in that we had many very late night meetings and conference calls and so on, struggling over. Our basic sense was that if we were to have a fair chance of, as a society, making kids safer, that this community level approach was the best bet. And our recommendations for the federal government, by the way, which were so specific that they involved, had they been carried out, almost 60 congressional committees and subcommittees. If you want fragmentation in government, by the way, we talk about fragmented agencies. It's nowhere close to the fragmented legislatures because nobody will give up authority in those instances. And we proposed a strategy, a federal legislative strategy that would have required multiple major committee chairs to agree to go together, which they've done only in a couple of instances, the Americans with Disabilities Act and the McKinney Homelessness Act. And for a while, tantalizingly, it looked as though we were going in that direction here. But the basic notion was that the role of government ought to be to facilitate community efforts. It's a very different view of what child protection is about than what's in the prevailing system, and certainly what's in the professional models. I said we struggled over it, and the struggle was, are things too bad to work? That is, if in concept this is the way to go, both logically and empirically, are there enough resources in neighborhoods that have been in decline for generations for people still to develop enough trust of one another and to find and pull enough together that they could in fact work together for the safety of their kids? And that's the reason for this title that I own this, as to how my faith in humanity was restored. Because I was one of the ones that was strongly in favor of this, but probably the most doubtful that we would get there. And my answer to jump to the ending is it's incredibly difficult. But you can do it. It takes really, to use the proverbial sports metaphors, it's a true full court press. But it's a full court press every minute of the game to do it in the communities in general. So strong communities, the long title was originally Strong Communities for Children in the Golden Strip. And we had a logo so we could fill in strong communities, strong communities for children in the whatever or wherever. And as I've already said, it's a diverse area of South Carolina, geographically pretty dispersed. It's an odd-shaped area, but be roughly 30 by 30 miles. As you can see, somewhere around 100,000 adults, a bit more than that now. And the Duke Endowments, the advisory board, because of our doubts, recommended, and this got lost in the shuffle as well, although we had a lot of programmatic or initiative recommendations, and particularly policy setting recommendations. Our basic notion was to really try this out, that we needed to establish something. The analog was to the enterprise zones, but to prevention zones that were disparate in region, disparate in demographics, where there could be a systematic trial before going, we hope, then to a national initiative. Needless to say, the feds didn't pick up on this. Although the ideas, I think it's fair to say, in the advisory board became pretty influential. In particular, the advocacy organizations in Washington, after intense struggle for a couple of years, began talking about doing comprehensive community strategies and really reshaping the way the federal government deals with child protection. So practice hasn't changed a whole lot, but the zeitgeist changed, which is not a small achievement, but that we're now 20-some years down the road with one big trial suggests how long it takes. And the folks that stepped up were not the federal governments, it was foundations. In particular, Ronald McDonald Charities attempted to do the version of what we were recommending in relation to home visitation aimed at increasing social support, which is a bit different than what's out there at present. And then the Duke Endowment, which is a large foundation that has specific mandates in the Carolinas, put what was ultimately about $10 million across 7 years into the process. The fundamental idea here is that the institutes and centers I directed over the last 30 years or so we had a mantra of sorts that we didn't have rituals of people repeating, but I always imagined that they did all the time. People should be able to get help where they are, when they need it, in a form they can use it with ease and without stigma, which is easy to understand, easy to visualize, not so easy to do, but is wordy in any event. And somewhere along the line, somebody, and I don't remember who it was, but it wasn't I, said this really is 5 words. It's people shouldn't have to ask. And so what you're going to hear is a strategy that's based on making it so that the norms of communities change, because it's easy for people to do what they would like to do, but the constraints get in the way of doing. So that we're talking not about trying to change people, but to enable people, to enable communities. And to do that in terms of having settings designed, either new settings or existing primary community institutions, designed in ways that help is built in. So the assumption is that we want folks not to have to be patients, not to have to be clients, and worst of all, not to have to be cases before they can get help. But it just happens. That people are treated with decency because they're people. And that means focusing on informal resources, not formal ones so much. So the ultimate goal of Strong Communities for Children was keep kids safe, and prevent child abuse and neglect. We didn't hide that our ultimate outcomes, and the ones the foundation were interested in, related to reducing child maltreatment, but it's very hard for people to think in those terms. That is, if you ask people what should be done to prevent child abuse and neglect, almost everybody starts talking about counseling, parent education, etc. If you ask them what would it take for children to be safe in their communities, then you get very different kinds of answers. And you don't have to be a high-powered professional to begin figuring it out. It really is common knowledge. What I take some credit for figuring out another level of this, though, was even at that level, you don't get it down to people thinking in behavioral terms. And again, of settings demanding certain kinds of behavior. So the way we operationalized child protection was that a setting is safe for children when every child and every parent know that if they have reason to celebrate, to worry, or to grieve, somebody will notice and somebody will care. So there's a surveillance aspect here, in a sense, not unlike the existing system, but it's oriented toward invoking caring responses, not investigations. And it's not just the bad times, it's the times that we think as people somebody ought to be paying attention to us because it's a good day too. And the corollary goal was that every family of a child under 6 who wants and needs somebody just for them would have it. So again, we're talking about changing norms so that people watch out for each other, that they respond in caring ways. A norm of inclusion. Over time, we started talking about leaving no family outside as one of the other slogans, because if families are excluded, or if members of families are excluded from the community, and in upstate South Carolina that happens a lot, literally because of incarceration rates, then there's no way people can notice and care for them. So we're talking about universality of access, a mutual assistance model where people are both givers and receivers, that we want people to notice that other people are noticing and caring, and so that they see the community as being a place that is welcoming, and in particular is welcoming for children, but that translates into things that not only that they should be doing that, but it's just how things occur. The example that I typically use is a silly one, which is we expect the fork to be on the left side of the plate. You don't have to think about it. You don't have to refer people to decide where they're going to go put the fork. The expectation is, because you see it all the time, is the fork goes on the left. And much the same way, to use another kind of example, that in this society at least we drive on the right. It's very hard to drive on the left side. Try it sometime. The road's engineered, the car's engineered, our expectations are engineered in such a way we don't dream of driving on the left, and in the instances when we have to, we're terrible at it. So what this then boiled down to was two different components. The one that, in my judgment's the core of it, was a community mobilization strategy. So ultimately, our advisory board kept asking, where's the program? And I kept saying, it's not a program, it's an initiative, it's a movement. I finally satisfied them by saying the outreach workers are the program. And then they were happy. But that we have more or less one outreach worker to a community. My sense is, based on experience, that it's about, the optimal level is about 1 to 10,000 people. We weren't quite that rich in resources. But it's significant if you're talking about across the whole society, obviously. But as a bang for buck intervention, this is a really cheap, high impact intervention. Then what we thought of as services, the second component, we called strong families, just to give us some differentiation. And basically the idea here is that the first years of the initiative are focused on mobilizing people to start to do specific things in the settings that they're a part of: workplaces, religious institutions, recreation centers, wherever, fire departments, and that we would then reorganize or newly organize those existing resources, both human and physical, to be places where where families can expect to come together. And I'll describe in a second a bit more what that means. The gist of this, though, in terms of the outreach workers, is although they did have backup from Robin and others, basically what they got were 10 principles. And I'll, for time reason, not go through them in depth, but I'll sort of highlight a couple that I think are particularly significant. One of them is the third one on this first slide or page, which is more is better. So the instruction of the outreach workers were, as long as what they were doing had some logical relation to child maltreatment based on our understanding of it. So it meant bringing people together in ways they felt more confident about how children would be cared for in the community, and that they would respond to one another accordingly. That we didn't care if they ever finished anything. This has a zero correlation with modern accountability principles. We don't care if they finish anything, we care whether they're starting things. And the logic behind this, in essence, was if you're going to change norms, it means you've got to get the message out in as many ways as possible, as often as possible, in as many settings as possible. And the analogy that I use, which is, and we're thinking about this a bit, which is actually a much simpler problem, although it's by no means simple, was smoking reduction and cessation. That is, individual programs, prevention programs, do very little in that instance, but we've had a culture change. And a culture change has been because we've made it hard for people to smoke, and in a variety of ways, and that they keep getting the message that this is not a good thing to do. So you can be Jack the Ripper, but you better not smoke when you do it. That's sort of the expectation in our society at this point. That it relies mostly on volunteers. Now, the asterisk here is that it's not necessarily volunteers in the way you think of them. That it's not people necessarily, although in some instances it is, signing up to do a particular thing and then doing it without charging. That we're talking more than that about making a commitment to change the way people live their lives. Not a small commitment. And in doing that, then, to change, to do their jobs and to live their lives in ways that made it more likely that they would connect with each other and that people would be there to be noticing and caring. A couple of examples. The one that I think is the most interesting that people typically is fire departments. There literally is not, until we did one, not an article in the literature anywhere that we could find on use of fire departments and anything having to do with child welfare. But they're great. They were our true outliers in terms of proportion, in terms of the amount of time they spent in the initiative, their commitment to it, etc. They've got a safety mission. They can go anywhere. They've got uniforms that are fancy. People trust them, and they've got time. And in many places, as in some of the communities in the area that's being talked about here, they've got other purposes beyond simply fire prevention and putting out fires that support ultimately being a child safety agency. So emergency responders is a common role. Some of the little rural departments in our area were also the recreation department, the water department, the sewage department. They're basically where people are. Another example is primary health care. We asked pediatric and family medicine practices not to spend more time on family support, but to reorient what they did in ways that it became supported. So, or at least not spend much more time. So they became an enrollment center. When you sign up for Well Child Care, you join Strong Families as a benefit of the practice, was the way it was presented. Instead of doing 6 well child visits in the first year, we did 12. And on the every other month one, besides focusing more on the anticipatory guidance sorts of things that don't happen as much as they should and would like to because of time, we did things that brought parents together. So forming babysitting exchanges, having ask the doc nights, etc. And then doing the well visits themselves in groups. So the families would be scheduled for an hour and a half at a time instead of 10 or 15 minutes. So it's changing what you do. The only resistance we ever got from communities was on this next top one here, which is we're interested ultimately in children, but the route to doing that is supporting parents. So we would say to the Kiwanis, for example, it's really nice that you want to read to Johnny and Susie. And if you'd like to do that, that's fine. We're certainly not going to get in the way of your doing that, but we don't think that's got much to do with kids being safer. If you really want to do something that's safer, bring a meal to the family so that mom doesn't have to cook one night a month or something like that. Again, a reciprocity, existing assets. So summing this as it then becomes, after the people come together, then Strong Families, again, we don't refer people, they join. It's a huge difference psychologically. And usually we tried to universalize it, to routinize it, so that joining or enrollment happened most often either the initial well child visit or enrollment in kindergarten, less frequently, but sometimes at community festivals. And we also tried to use people that had access to folks coming into the community, real estate agents, property managers, and so on, as another source of enrollment. And in a year or so, that got about 3,000 families formally enrolled, but many, many more than that participated in community activities. Our best estimate, extrapolating along the way, was there were about 25,000 family events in a year in an area that's got about 100,000 adults in it. And as you can see, where they happen is, again, not special places, but it's in very disparate places. So while more than a third each were in churches and community centers, schools, libraries, fire stations, police stations, businesses, et cetera, were also family activity centers. And basically, as we got into this, and we ended up, to sort of jump ahead again a bit, this was conceived as a 10-year initiative. It ended up being 7. And so things that I had expected, I think, would have become fully institutionalized, didn't in some instances. Things are different, but they didn't get to the point they became ongoing necessarily because we lost our outreach workers as we were moving into the institutionalization phase. But what we were doing with this army of people, which became about 6,000 volunteers, was that we said that if you live in the Golden Strip area of Greenville County or in northeastern Anderson County in South Carolina, and you have small children, you'll know no matter who you are, when you move in, if you join Strong Families, you get 5 things. One of them was play groups. And while they're, again, fine things for children, we weren't really interested in what the children did. What we were interested in was the parents talking while the children were playing. Parents' nights out, both as some immediate relief, but also encouragement of interaction among parents, or couples activities. Parent-child activities. By the way, our Hispanic families resisted parents' nights out and so on. They really, truly wanted to do things as families. And extended families. So this was the part of the hook in getting them into doing things. We didn't have the resources to bring a lot of jobs together, but we at least had the resources to help people to think about how they would get jobs and to build their careers. And then we had professionals, either their agencies or they themselves, donated time, not to do what they usually did in clinics or centers, but to give plain label assistance, to be generic helpers. And so it would be announced that on Tuesdays and Thursdays from 3 to 6 at Shady Grove Baptist Church, there'll be a family advocate, and they do these things. Again, the family activity centers are free. They're out in the community. There's child care, not so much for the parents to come, but to serve as volunteers. Quoting Mr. Rogers, this is all oriented toward givers and receivers. Mr. Rogers had a lot of wisdom, by the way. So who were they? Everybody, pretty much. I'll not elaborate this, but you can imagine as I flip through the people we're recruiting, you'll notice human service professionals don't show up on this list at all. And they may show up because they're in the community, but not because they're human service professionals. The volunteers look very much like the community. In a children's initiative, we had about 40% male. Our most active volunteers were male. About a third were minority, which is more than the Sant community. Age looks about the same. And this, if you know the literature on volunteering, is not the way that volunteer programs usually look. That is, volunteerism tends to be skewed fairly heavily toward people that are better off and more highly educated, and not so many minorities. And it was steadily growing across the initiative. The amount of time that people gave, we counted 60,000 hours. That's probably way under what it actually was. This is the number of organizations. So you can see we've got more than 200 churches in an area where churches are very conservative and people think they don't do anything for communities. We use bulletin inserts as one of our entries. I'm probably one of the few people that could put it in my resume. Business involvement usually started with finances, but moved to doing other things in terms of doing direct assistance to employees and the community more broadly. The basic message is it's not only more people, but they keep doing more and more things, more and more kinds of things. So then what difference does it make? Well, my first answer is just everything I told you up to now is a big deal. That is, I would like to live in a community where I knew that there were somewhere around 6,000 people, 6,000 adults out of 100,000, still a small percentage, but that many people in absolute terms that have committed themselves to watch out for families. And we did, by the way, commitment cards that had things like learning the names of the children in the 10 closest houses, besides giving time and leading in different ways. And a very elaborate outcome. So the basic idea of this being a place where people have things to do, that they're connected with each other by itself is a good thing. But in terms of the safety goal, we did a survey of, as I've already mentioned, randomly selected households of young children. These are not the same households necessarily. 2004, 2007. This is conservative in both. We didn't do a third wave that was planned because the funding ended earlier than we thought it would with stock market changes, et cetera. but also the baseline, the initiative actually started in 2002. So this is one of the things is that we knew change had already happened. But basically, we've got a pretty strong case from interviews of parents in the service area and in matched block groups elsewhere in South Carolina, also randomly selected in household surveys, that norms of parental life changed. And this by itself is big news to me. And that the parents in the service area across time and in comparison with the comparison communities, by the way, they at baseline were in fact pretty similar. But as you can see that they both experience life being a bit easier, that they perceive there being more help available from people that they could recall more frequently, more sense that the community really got things going, more the use of baby gates, et cetera, were substantially higher in the service area than the comparisons. And then impressively, when you ask parents questions like, how often in the last month have you been too tired to prepare a meal for your children? That we got pretty big differences. And interestingly, we also asked positive questions, like how often have you hugged your child the last month? And you get huge numbers. And I thought that was an okay thing to do because it would make the interview not quite so blasting you. But I was confident they would show nothing because of ceiling effects. In fact, the positive changes are stronger than the changes in terms of decreasing negative behavior. That is, parents reported doing more things with kids, engaging with them more frequently, et cetera. We got almost a difference, a significant difference in terms of changes in corporal punishment rates. It was P less than 0.06. And again, our power analysis was based on having a third wave, so I think that's probably a power problem. And what you'll see is not only we get differences, but they make sense, regardless of the measurement. So besides having the surveys, we also looked at CPS referrals and substantiations, which I thought would show nothing because my instinct is it's mostly administrative behavior you're looking at there. And also at hospital admission rates, ER use, et cetera. And what we see is we get big differences comparing the service area with the comparison area in ways that make sense given the initiative, which was focused on families of young children, under 5. So the effects are strongest, but you still see them in elementary school age, which also makes sense because lots of elementary school age kids have preschool. Elementary school age kids are in families that also have preschoolers. And schools also include kindergartens and so on, as well as 3rd, 4th, and 5th grade. You can see the same, not only the CPS change in this direction, but the differences are similar in terms of hospital admissions, ER use, et cetera, that there's fewer injuries to kids, and it's, again, focused primarily on younger children. By the way, the variance that's accounted for is stronger in this instance on physical abuse than it is on neglect, and even than it is on sexual abuse is stronger than on neglect. And I think that's simply a reflection of ICD-9 diagnoses don't show neglect very well. So when you take that into account, with the neglect differences here, are still pretty amazing to me. We also had, by happenstance, the state in South Carolina does an annual survey of parents, teachers, and school kids at the last year of each school. So end of elementary, end of middle school, end of high school. And this, again, I think is spillover. But in the strong communities area, the parents, teachers, and especially the children, interestingly, reported being safer, having more openness to parents and so on, again, across time and across comparison areas. By the way, we took everything we could think of that had a social effect to it, and where there are trend data, they're easily available. And this pattern doesn't show up on teen pregnancy. It doesn't show up on juvenile justice referrals, et cetera. It doesn't show up on dropouts. It's specific to safety of young children. So there's a journal issue that done in 2008 in Family and Community Health that gives a lot of the intermediate level results. There's soon going to be a section of child abuse and neglect. There's a chapter coming out in in Corbin's Handbook of Child Maltreatment, and then a special an edited book as well. But Jeanette Lancaster, who was the editor of Family and Community Health, says basically that what's really striking about this is not only do our children better off, safer as a result of this, but the community itself looks better, in a sense, in terms of it being a place to live. So to summarize what we know about the effects, again, extraordinary levels of community engagement. And I said this was hard to do. Those of you who know me know I work very long hours and am fabled for doing it, and I expected to in this. And I worked longer than I've ever worked while I was doing this. But the way I spent my time was not what I was expecting. I was expecting I would be spending all of my time putting out fires. Not literally, but, Church A doesn't have the same theology as Church B, and they don't like what they're each doing with children. Agency A thinks that they own this population, Agency B, person A and person B, and don't get along, whatever. It just never happened. The only sorts of instance that we had in that instances were a couple of places where we actually paid people to do things, which was a mistake. But otherwise, race disappeared and I truly don't think it made a difference. Gender made very little difference. Class made no difference in engagement. The breadth increases. There's changes in the parenting as a phenomenon. Kids are safer according to parents' self-report and according to multiple archives. And again, that it seems to have some spillover effect to older kids. And that's particularly striking, again, because we finished a bit earlier than we expected, so there wasn't as much institutionalization as I had expected, but also because other indicators kept getting worse. That is, it's not, sometimes it was they didn't look as bad in the service area as they did in the matched communities. But, for example, in both areas, or both groups of areas, parents belong to fewer things after 3 years. It's the big disengagement trend there is in the society as a whole. And so, to me, though, the message here is even amid the strong push toward greater isolation, greater alienation, you can, in fact, engage people around the goal of safety of kids. And that they will, in fact, change how they live their daily lives. And importantly, given our ONCS and the advisory board, that it happens at least as much, and I'll show you now more, in neighborhoods in high need than in those that are relatively well off. By the way, we interviewed volunteers about why they were involved in this. And the usual finding in the volunteer literature is that people volunteer because they do want to be nice, but they also want something else. They want job skills, they want connections, they want new friends, etc. And in our interviews with volunteers in strong communities, both those that were relatively minimally involved and those that were our true leaders, it's altruistic goals are all that come up. The service area can be divided more or less on east-west basis, and unless you're a South Carolina obsessed person, these communities are not going to mean anything to you. But the difference, the east, for heuristic purposes, are relatively wealthy suburbs, small towns that have emerged into highly dispersed suburbs, are high growth areas. The west is truly rural area, like there wasn't a licensed child care home within about a 20 square mile area, I think. And also mill towns. And Fountain Inn is a small town / suburb, old mill town that's growing rapidly, but again is working class. And the interesting thing is that we got the same ultimate outcomes, that is children's safety looked the same across between the East and West. But the level of engagement in the West, in the needier communities, was much higher. And that was even though it took longer to get going. And I think it's because when you start trying to do the things we were wanting people to do were in fact what it takes to get organized. And that the process of doing that in communities that have relatively few resources have pretty strong response in terms of enabling safety for children. In the affluent areas, there already were lots of institutions, but not necessarily investment in terms of children in particular. And the new norm, and if I had it to do over again in the wealthier areas, I would use media strategies probably rather than old-time community organizing. Ultimate lesson, one person really can make a difference. Remember, this is one person. In some areas, there's communities they were serving had 50,000 people in them. And when I said that they kept doing more and more, we've got notebooks in single space of interviews summarizing what people were doing, that in any given month, by usual standards of foundation and so on, we would start hundreds of programs. And the result then is a movement in which, in fact, children are safer, but we've also got nicer places to live. And by the way, that was symbolized, to end this, and we've got a few minutes for questions, I guess. All the communities that were participating had signs on the entryways that said, as an example, Simpsonville is a strong community for children, with a little logo then of kids playing. And so we did a lot of stuff that reified that message that there were good things going on. Lots of community celebrations. One community wrote a book together, which we distributed to every family in the community, about 5,000 people, with stories of people doing things so that families were more connected in the end and kids were safer. Fire departments, all the fire departments and public safety, law enforcement agencies wore our pins. They put strong, our family helping your family on their fire trucks. It's a lot of this continually giving the message that's the key. And it takes time and it's hard work. Questions? Yeah.
Can you pick this up in that very last slide where you said a carefully planned, ethically coherent, and empirically grounded initiative? Can you elaborate on the ethically coherent? What does that look like?
Meaning that it is founded in respect for people and their engagement in doing whatever they can wherever they are, of galvanizing communities in ways that the personal security of the people whose security is most in doubt is protected. And I think that's a lot of why we got so many churches engaged, is this is real golden rule stuff. So even the ones that were the most conservative, that if it doesn't, they give meals and they do prison visits because it's mentioned in the New Testament, but they don't visit them after they get out of jail because that's not mentioned. But we asked churches to do, all the institutions had different roles. So churches had, we looked to be communities of service, to be places of reconciliation and engagement of people on the periphery of the community, and to be moral beacons, to literally use the pulpit. So that's one of the things that's significant about this is there's been a lot of discussion of religious institutions and child protection, but it's been mostly in trying to make churches into fortresses in a psychological sense. And instead we looked at them as primary prevention assets. Bulletin inserts were a pretty important way of getting that started, because we would do, even though it was a public university, we didn't do God talk. We sounded enough like it. So we would quote Bishop Tutu, on Ubuntu and what that meant, and again, norms of reconciliation, et cetera. And it's not very hard at all for folks then to begin putting that into their own ecclesiastical language.
It's such an exciting model, and there's an equivalent model in public health, the community-based participatory research model. And I wondered if you went into that. It just seems like it would be so beautiful to take some of these community-based participatory research model and extend them. They're now working on obesity, working on HIV prevention, and extend them, expand them into the whole child abuse prevention realm.
Yeah, I mean that's a less ambitious goal, but you're right. It's in the same ballpark. I am the community research per se, I think doesn't get at ultimately what it is you want to have happen, which is that we are interested in being learning communities. In that sense, it travels over and being reflective. But we're more interested in day-to-day interaction among people and not as a knowledge-generating process per se. And frankly, some of the research in this is really technical. And so you can feed back results, but getting people as partners and doing it is not so easy. Any other? Okay, well, thanks.
Thank you.
Sorry?
That was great. Thank you.
Thanks.
I enjoyed